This is something that I've raised in the House for years, so I'm glad that we're having a chance to debate it. I'm hoping that there's some cross-party collaboration so that we can move forward with having a motion we can all support. But I am going to speak to some of the issues with radon, what I think needs to happen, which won't all fit into this motion, and where we go next. Et honnêtement, Madame la Présidente, ça me fâche un peu quand je vois quand il y a les gens dans le gouvernement, ils attaquent l'opposition et l'opposition attaque le gouvernement. Et sur les deux côtés, il y a des gens qui n'ont pas fait ce qu'il fallait sur des enjeux. Et je pense que nous pouvons trouver une façon de travailler ensemble, aller de l'avant et d'arrêter de s'attaquer entre ces deux côtés. I want to acknowledge there are so many people touched by lung cancer, specifically touched by this issue. Earlier this year, and I know her name's come up, Angela Steve Lee passed away and was diagnosed with stage 4 lung cancer as a result of high levels of radon in her home. And she became an important advocate for radon testing, especially in her community of Havelock. And I hear what the Minister of Environment is saying about making sure institutions have clean air, and I support that. I think we need an Indoor Clean Air Act. I think we do need better air quality in our institutions. But what's happening in individual homes all across the province is really scary. There's a new report that's come out, the 2024 Cross Canada Survey on radon, and the numbers are staggering especially for certain parts of the province, Madam Speaker. And so in Moncton, it's 1 in 12 homes that were tested that have above 200 becquerels per meter squared, which is that at above 200 is when the concern that it will cause lung cancer comes into play. So that's 1 in 12 in Moncton. In St. John, it's 1 in 5 homes that have this this level. In Fredericton, it's the same. 1 in 5 homes have over 200 becquerels meter squared. In Bathurst, it's 1 in 2. Madame Speaker. 1 sur 2 des maisons à Bathurst ont des niveaux élevés du radon, et c'est vraiment épeurant. Et c'est un enjeu de la santé publique vraiment sérieux. Il faut prendre action. On peut sauver des vies. C'est environ 16% des personnes qui meurent de le cancer des poumons qui ont ce cancer à cause du radon. Ça veut dire qu'avec les fonds et l'action immédiate, on pourrait, à un certain point, sauver 16% des vies, 16% des personnes qui sont décédées à cause du cancer des poumons. C'est beaucoup, Madame la Présidente. Ça pourrait dire sauver environ 100 personnes dans le Nouveau-Brunswick chaque année. C'est vraiment quelque chose qu'il faut prendre au sérieux, et je veux voir plus d'action. We must protect New Brunswickers from radon. And it is unfortunately something that's been ignored for too long. I mentioned some specific cities, but it's about a quarter of New Brunswick homes overall that have elevated levels. And I do want to talk a bit about the NB housing units that have elevated levels of radon, because in the Auditor General report in 2020, it was found that 33% of the NB housing units that were tested had unacceptably high levels of radon as of 2019. And yes, the plan was to test it over the next 23 years, and it was a bad plan, and I'm glad it was abandoned. There was a commitment to do the testing over the last winter for the NB housing units, and so I would call on this government to release the findings for the data on the radon levels in New Brunswick's public housing units, so that we know what we're dealing with. We know it was a third of the ones tested, so I'd like to know what's happening there in terms of the radon levels found, and the plan for the government, who's the landlord of those units, what they're going to do to remediate and how quickly. Because there are people who are living in those units. Do they know that they're at risk? And I think there's a responsibility on this government to make sure that they remediate quickly to protect the people who are living in NB housing units. And of course, the problem does not end with public housing units. We need homeowners to be testing all across the province. There are some hot spots, certainly, but just because somewhere is not mentioned on this list doesn't mean that they're not at risk. This needs to be happening in homes across the whole province, Madam Speaker, because having that information means that remediation can happen and it can save lives. The remediation step is really important as well. And I'm glad that there's discussion about finding ways to support people with that step, because they did this testing in Havelock thanks to the advocacy of Angela Stiefel, and then there were people who found that they had really elevated levels of radon in their homes, but they didn't have the money, the cash flow, a way to remediate. And so we need government to step in when people can't, because that, again, can help save lives. It can help prevent lung cancer, and we must do better. This is a major public health issue, and at this point, I feel like we've really just scratched the surface. And so, another issue I want to raise as I discuss this is, I'm a fan of improving energy efficiency. I think that's one of the ways to address the climate crisis. When energy efficiency measures are taken in a home, it can help seal up the home, which is good to keep heat in the winter, for example, but it can also trap radon gas much more effectively. And that can be an issue in some homes. And so I think as the government is looking at existing and potentially future energy efficiency programs, that testing for radon should be part of those programs to identify where there's radon, and to, when they go back to check to monitor the energy efficiency levels, to see what the radon levels are and if there's been a change. This is something that needs to start being built in, not just to building codes, so that so it's much easier to remediate and it's less of a problem going forward, but to address as we move into more energy efficiency, hopefully, then to address that issue. And so, Madam Speaker, I do want to just mention some numbers, to talk about, like put it in numbers, how many people are impacted. And so, as I said, it's about 16% of lung cancer cases that are essentially preventable. So we could prevent 16%. And in 2022, in New Brunswick, 860 people were diagnosed with lung cancer. So 16% of that is 138 patients. So could we prevent 138 people in New Brunswick from getting lung cancer each year from being diagnosed? Yes. If we were to actually thoroughly implement the measures needed to address radon, we could reduce that number. In 2022, 600 people died of lung cancer in this province, and 16% of that is 96 deaths. This is significant. I feel like it's not often that we have something so tangible and clear to solve a problem. Like, oh, this is a problem. You know, unfortunately, it's invisible. We can't smell it. We can't taste it. So it's hard to know it's there. But if we do testing and remediation, we fix the problem. There aren't, a lot of the problems we discuss in here aren't so clear-cut. And so we must do more. And I don't think, I know this motion won't fix everything. I hope this is, you know, part of the beginning of the move towards addressing radon in New Brunswick. And I want to thank the people, I especially think of the people at NB Lung, but I know there are people who have been advocating around this issue for a long time. We need to be listening to them. And I want to thank them for their continued commitment to raising this issue, along with other important air quality related issues and health issues. There's so much more we can that can be done when it comes to preventative health care. And so I am going to move a sub-amendment that has some cross-party collaboration, and this motion, or this sub-amendment, is seconded by the member for Woodstock-Heartland, that the amendment to motion 6 be amended by deleting all the words after and replacing it with and substituting the following: to make free 90-day radon gas tests accessible to the general public, to engage public health in order to support promotion of tests, and to explore ways to support individuals with radon mitigation. Merci, Madame la Présidente.